All right, I think we'll go ahead and get started because I don't want to run over, and I want to make sure you get to see every slide. All right, everybody knows who I am. Mike Sheehan. I'm one of the trauma surgeons here. I kind of picked this topic because there's a movie that just came out. It's called The Lazarus Effect. And so I had been looking into something else, and it seemed like a cool title for what I was going to talk about. So
same dream.
Good morning, Dr. McConnell.
Good morning, James.
This whole process started with the Lazarus serum. The goal here is simple, to bring someone back from the dead.
About one. In 3, 2, 1.
No effect. Maybe if we up the dosage next time, if we up Is you okay?
You are playing God with a bunch of dead animals. If we're going to be asking big questions, we have to be ready for the answers.
all right, the whole key to the thing is watch the dog. All right? That's going to come up later. So that's what we're going to find out. Is this really possible? So suspended animation, hibernation, there's a bunch of different names for the same concept, has been very much used in a lot of different movies. 1967, British secret agent's been frozen, waiting the day when his nemesis shows back up again, only to be thawed out to help fight. He's been in there 30 years. Who is this? Anybody know? It's a movie. Austin Powers, that's right. I just hope that that's not what we look like if we get frozen. What about Demolition Man? Another one of my movies I've seen before, not my favorite movie, but Sylvester Stallone, it's a police officer, his nemesis, both involved in a bunch of people getting killed. He gets blamed for it, so they get put in cyber prison. Well, unfortunately, the villain gets thawed out, and he's back on the loose, and now we have a little different situation.
You, give me a Marlboro.
Yes, of course, right away. What's a Marlboro?
Just a cigarette, any cigarette.
Smoking is not good for you. It has been deemed that anything not good for you is bad, hence illegal. Alcohol, caffeine, contact sports, meat.
Are you shitting me?
John Spartan, you are fined 1 credit for a violation of the verbal morality statute.
What the hell is that?
John Spartan, you are fined 1 credit.
Bad language, chocolate, gasoline, uneducational toys, and anything spicy. Abortion is also illegal, but then again, so is pregnancy if you don't have a license.
So it looks like when you come out, things are not very friendly or nearly the same. We all remember Alien, and the funny thing about this is everything looks so sterile and clean, and they have these beautiful covers. But I thought the funny thing about this picture was no one has a shirt on, men or women. I mean, why do you got to go in hibernation with no shirt on? I just couldn't figure this out, but I mean, they didn't have any shirt on. I thought that was kind of funny. One of my favorites, Star Wars. Now, they didn't use ice, they used carbonite. Oh, Princess Leia is so sad.
Oh, they've encased him in carbonite. He should be quite well protected. If he survived the freezing process, that is.
Well, Calrissian, did he survive?
Yes, he's alive.
And in perfect hibernation.
He's all yours, bounty hunter.
Idiocracy. Anybody seen that movie besides me? All right. Well, it takes a little background. This is certainly a B-rated movie, but basically the premise was the military was doing some secret testing on how to put humans in hibernation, and so they thought they came up with the technology, and they decided they needed to test it. So they said, well, who would we miss? That no one else would notice this person was missing if we put him in hibernation. So they picked the two stupidest people they could find. A guy that worked in the military, in the supply tent, and a prostitute. And so they get frozen, and of course, now remember, they were the dumbest people that they could find.
At the dawn of the 21st century, the Army began a top-secret experiment.
Meet Joe Bowers, our first subject for the human hibernation experiment. As you know, this is highly classified. However, if successful, we believe humans can be stored indefinitely.
However, the trial run was prone to human error.
See you in a year.
And Joe slept slightly longer than expected. Half a millennium, to be exact. From Mike Judge, creator of Office Space and Beavis and Butthead.
Oh my God!
If you were the smartest person in the world...
This goes in your mouth. This one goes in your butt. Hang on a second. This one goes in your mouth. This one goes in your mouth.
So the whole premise is that after 500 years, when they come out, they are now the smartest people in the world, because what happened is that all the people that were smart and doing research and everything didn't have any kids. They didn't get married. They didn't have families. They just did research. They die off. The other end of the spectrum continued to have numerous kids, not work, live off the land, and so we ended up with a population of people who had no intellectual prowess whatsoever, so now the two stupidest people are now the two smartest people in the world. Unfortunately, if you watch the movie, there's kind of a little satire there that there's a little truth in there somewhere. And of course, even Futurama, the Hall of Presidents, where they save all the heads, keep this image in mind as well, where they have the heads of all the presidents in some sort of suspended animation. So when we look at this, there's a bunch of different terminology, and unfortunately, a lot of it has some similarities, and some of them are talking about the same thing and different things. And even under suspended animation, hibernation, hypothermia, and cryogenics is also considered under suspended animation, but they're still not all the same. So we're going to kind of go through that a little bit. So hypothermia just means that your temperature is below normal. And there's varying degrees. There's 4 different categories: mild, moderate, severe, profound, and of course their definitions are there. So hypothermia goes way back. Hippocrates noticed that if you pack the wounded soldiers in snow and ice, he advocated that. He thought they would do better. And hypothermia has played a major role in a number of military campaigns, not for the good. Hannibal lost nearly half of his men in 218 while they were trying to cross the Alps. And Napoleon's army was nearly decimated during the War of 1812 as they were fighting in Russia. But in that time period, what the medics noted, that the wounded infantrymen who were left out in the cold did better than the officers who got to stay by the fire. So loss of lives through hypothermia continues in one degree or another throughout the world wars, both the First and the Second. And in the Second World War, the Nazis experimented on humans with numerous cold experiments. And as we'll see later on, and there's some experiments that the Russians did in the 40s as well. Civilian examples of deaths caused by hypothermia are found in the sinking of the RMS Titanic, Lusitania, and Empress of Ireland. Oh, and who remembers this movie? Oh, yes. But there's a new star. I really toyed with who I was going to put in the front picture. I had some ideas, but I didn't really want to rope them into us. So we just leave them there. So hibernation, a state of inactivity and metabolic depression in animals. Lower body temperature, slower breathing, lower metabolic rate. They conserve energy, especially in the winter, and they use body fat. So their fat is converted by gluconeogenesis to glucose to provide their energy. Their slowed metabolic rate is what leads to their lower temperature, not the other way around. So it's not that it's cold and they lower their temperature is that they lower their temperature because their metabolic rate is slow. So, as we know, the animals that do undergo hibernation, they go on a big eating binge beforehand to store a lot of fat so they have something to live off for the winter. The thing about hibernation is that, realistically, it's not a continuous process. It's typically interrupted by a period of time where they awaken and raise their body temperature, gets to about normal level, and then they go back down again. The interesting thing is hibernating animals, being supine, lying down, inactive all that time, they don't get blood clots. And what they found is that as these animals cool, their platelets disappear from the bloodstream. And they promptly reappear when they're rewarmed. So this suggests that they're preserved somewhere in the body. They don't know where they go. But the platelets disappear and then rapidly show back up again. The other thing they find is the lymphocytes disappear from the bloodstream as well, and they migrate to the lymph nodes and stay there. And then with 90 minutes of awakening and rewarming, the lymphocytes reappear again. So this dampening of the immune system prevents the general inflammation that occurs during rewarming. In humans, that rewarming is what frequently causes the non-hibernators to suffer kidney damage. So the animals have some pre-existing methods to prevent complications that we get. In Germany, they stumbled on accidentally that they took a culture of hamster cells, and the guy who was doing the research, it was a student, was supposed to take them out. Well, he forgot them in the fridge for a week at 5 degrees Celsius. After a week, the hamster cells were still alive, but they had this smell of rotten eggs. So they took the medium that was around these cells, and they thought, well, they'd dump them over some rat cells that die as soon as you put them in the refrigerator. Well, they put them in the same fridge, they waited, and normally the cells would die quickly, but these did not. So after 2 days, the rat cells were still alive. So they're trying to analyze the products that they found in this rotten-smelling goo that was secreted there, and they found that it's probably an enzyme known as cystathione beta synthase, which stimulates production of hydrogen sulfide. We're going to talk about this later on, this hydrogen sulfide. Of course, that gives you the rotten egg smell. So what we know about hypothermia in medicine, it is protective when it's induced before an anoxic result. So if they cool you down before you lose oxygen, and they found this by looking at cold water drownings, that it protected you. It's also an anticonvulsant. It can stop people in status epilepticus. It decreases cerebral edema after traumatic brain injury. It's used for cerebral protection during operations involving cardiopulmonary bypass, and this was proven back in 1993. And in cardiac transplant, they typically take the donor heart, inject it with potassium, they pack it in ice, and that'll keep it good for 4 to 6 hours without perfusion. And when you cool an organ from 37, which is your normal temp, down to 0, your metabolic rate drops by a factor of 12 to 13 times. And that's kind of what happens in hibernating animals. And of course, the 2005 American Heart Association on therapeutic hyperthermia for people who come back from cardiac arrest is 12 to 24 hours of 32 to 34 moderate hypothermia. And then if you don't remember, Kevin Everett played football. He was injured, NFL player. And so he was paralyzed on the field, couldn't move, broke his neck, went to surgery. And the interesting thing is that they gave him steroids, which we've kind of gotten rid of in cerebral or in spinal cord injury. But then they took him immediately to surgery, and they took off the back of the vertebrae to decompress the spinal cord, and then they put him on hypothermia. So they lowered his temperature to about 32 for 24 hours. And he had full recovery. So there's been a debate about whether it was the early surgery and decompression or whether the hypothermia that they put him under led to his rapid return of all neurologic function. I'm still surprised they gave him steroids, but they did it anyways. But, I mean, he's not playing football anymore, but he's also not paralyzed anymore. So cryonics. Cryonics is a little different. It's extremely low temperature. So we're not talking like 30 or 32. We're talking much lower. And so this is the extremely low preservation of animals, humans or otherwise, with the hope that healing and resuscitation may be possible in the future. The goal, reanimation. That's the terminology in cryonics for when they bring you back. It's called reanimation. They're using your body as an ambulance to the future. So they can't fix what's wrong with you now, but we're going to save the body the way it is and hopefully wake you up hundreds of years from now, and we'll know, one, how to do that, and two, how to fix what was wrong with you in the first place. That's the goal of cryonics. Cryonics was actually proposed back in the 30s. There was a book written by Neil Ronald Jones called The Jameson Satellite. And he writes in his book that he has, the person in the book has their body sent to the vacuum of space, frozen for millions of years, till the aliens find him, repair his brain, and bring him back to life. Edinger, who was the founder of cryonics in the United States, proposed that why wait for the aliens? That technology may be available here someday, so let's just freeze people here on Earth and not send them out there. And that's kind of how cryonics got started. So this is actually a picture from the book that Jones wrote of what he thought that him being frozen in space waiting for the aliens would look like. And actually for 1931, this isn't really too far off. You know, look at it. It looks just kind of like the view we saw with Alien. No shirt, clear thing to see through, and of course various things to keep them going. So the whole deal with cryonics is, when are you dead? So a declaration of legal death does not mean that life has suddenly ended. It's gradual, not sudden. It may seem sudden, but it's not quite that sudden. Because we say a person's legally dead if his brain's still working, but his heart stops. So as soon as we see the heart stop beating, you can be pronounced dead. Your brain doesn't have to be non-functioning. We're not doing any EEG until it's completely flat. Now, you can have brain death and have a heart still functioning. So a person's legally dead is the brain's still working, but the heart's dead. Totally dead means both the brain and the heart are stopped functioning. Cryonics has to come in here. Cryonics cannot be performed if the person is considered totally dead. They cannot bring you back from total death. They have to step in when you are legally dead, not totally dead. So when are you dead? The most vulnerable neurons in the brain are the CA1 neurons in the hippocampus. And in as little as 10 minutes, they're fatally injured. However, injured cells don't actually die until hours after resuscitation. It's interesting, they found that the delayed death can be prevented in vitro by giving them an anesthetic, even after 20 minutes without oxygen. So if you give somebody isoflurane, which is a common anesthetic drug, 20 minutes without oxygen, it delays brain injury. And in other areas of the brain, human neurons have been recovered and grown in culture hours after the person's been clinically dead. And the whole goal of cryonics is save the brain, hopefully bring along the body, but that's not necessary to have the body. They want to save the brain, thinking that they'll have some other mechanism or body or whatever in the future. They now know that brain failure after clinical death is from reperfusion injury. So how do you do this? Got to join a cryonics facility. Now, our Clinton Township, Michigan, Cryonics Institute is the closest place, so you don't really have far to go, and they don't have far to go to you, which is important, because when you're dying, they need to get there and get you frozen, cool down. I don't want to use the word frozen. Cool down before you're totally dead. Alcor is located in Scottsdale, Arizona, and in Louisiana, there's actually a pet and animal cryonics institute that is saving endangered species and animals and freezing them in the hopes that later on someone will be able to bring them back. So when you are declared legally dead, an emergency response team jumps into action. They cool you down, throw you in the ambulance, and bring you to the center. During that time, they put you on a machine to circulate cool fluid and an anticoagulant so you don't clot. They take you to the cryonics facility. So, Clinton Township's not that far, so for us it's good. You just can't freeze the body because of the water. When you freeze water, water crystallizes, it expands, and if there's water in a cell, it will crack the cells apart or crack the cells apart from each other so that even if you reconstitute it later on, the cells have been damaged. So the water has to be removed from the body, and they call that procedure vitrification. Now, they don't really tell you how they do that. And they don't really know if what they do works because no one's ever been back from cryonics yet. But they remove all your blood, and they replace you with a glycerol-based mixture they call a cryoprotectant. And then they deep cool you to 202 degrees Fahrenheit, negative. Then they put you in a container head down. And the idea for head down is that if there would be a nitrogen leak from the tank, they're trying to save the head, that if it leaked down before they got to it, the head would still be in nitrogen and it wouldn't suffer. Versus if the head was at the top and there's a leak at the tank, before they could be notified, the head would be exposed, it would thaw out, and then no saving it. So then they cool you to negative 320, and that's how you stay, negative 320. So if you opt for cryonics, typically they store about 6 bodies and or heads together in one. So this is what the tank looks like, and then each one of these has a little separation, so there could be a body here or a head or both. You don't have to do the whole thing. You can do just your head or your body and your head, but you can't just do your body and no head. So just in case you're interested, here's how much it costs. All right, fair amount of money. But the interesting thing, and I didn't realize this until I looked this up, is that most of this is financed through life insurance. So you basically take out a life insurance policy that pays the Cryonics Institute when you die. That's how they get their money. But the thing is that you have to pay for all these other days to be on standby. Say you're getting sick and you're getting close to death, but you haven't died yet. They got to be on standby because they need to get there. And so the longer it takes for you to die, the more days you have to pay for. And so just to be cryopreserved, it's about $28,000 to $35,000. But all this other stuff, these days where you have to be available for standby and all this kind of stuff, costs even more. So it can be up to $150,000 when you get down to it. Famous people are frozen. James Bedford's actually the very first. He was from California. I think he was a psychology professor. He's the very first person ever frozen. He's still frozen. But in people's analysis of what they used, they're not even sure that what they used actually did what they said it would do. So even if they were able to save him, there's not going to be anything left. But he's still frozen. Ted Williams, of course, that was a big famous thing because of the battle over the family. He is frozen. Dick Jones, who wrote and produced the Mary Tyler Moore Show, Bob Newhart, Facts of Life, is frozen. John Williams, who's Ted Williams' son, is frozen. So the whole family's crazy. Walt Disney is not frozen. All right, there's this rumor that Walt Disney was frozen, and he's not. He was cremated about 2 hours after he died. And then the rumor goes that he is buried under the Pirates of the Caribbean out in Disneyland. He is not there. He was cremated. Famous people are planning to be frozen. Seth MacFarlane, Larry King, Simon Cowell, Paris Hilton, Muhammad Ali. The problem is reanimation, bringing you back. If you are successfully reanimated by looking at even how the movies have got it at the beginning, you're likely to be a freak. I mean, when Sylvester Stallone comes back, you can't cuss. You can't get anybody pregnant. There's no chocolate. There's no caffeine. I mean, what's worth living for? He can't even find a cigarette. The other thing is you're likely not going to have any immunity to any of the current diseases because in that 200 or 300 years, they'll be much more developed or totally different from what you had. And no one you knew is going to be around. So you'll have no friends or family. The thing is, at this point, it's universally agreed, even by the people in cryonics, there's no technology available in the near term to bring you back. Few organizations survived for centuries, and in fact, one of the very first cryonics places went out of business, went bankrupt. And all those bodies either thawed out or they had to be transferred to another cryonics place. So who knows if cryonics from Clinton Township, Michigan is going to be here in 200 years to be keeping you frozen. Plus, when you look at it, when they revive you, you have to be revived from a lack of oxygen for a really long time. We don't know what the toxicity from the cryoprotectant they injected you with is. The fracturing that certainly occurs because there's no way they could get all the molecular water out before you froze. You're going to need physical therapy to regain function in your body. Your muscles would have been sitting there for hundreds of years doing nothing. So it's unlikely that you'd be able to stand or move anything. Plus, you'd have to figure out how to reverse what the patient died from in the first place. You'd have to have the technology and the ability to fix what was wrong with them at the end. And then you're likely going to need tissue regeneration because whatever you had, you're probably going to be old, you're going to need some things, so you're going to have to be able to make something new. So how are they going to do, how do they think reanimation is going to be done now? They're talking about nanotechnology and nanorobotics. So nanoscience and nanotechnology involves the ability to see and control atoms and molecules. So for reference, a nanometer is a billionth of a meter. So there's 25.4 million nanometers in an inch. Or a sheet of newspaper is 100,000 nanometers. So when we start looking about things we're talking about for us, A DNA double helix is only 2 nanometers in size. But I guess I thought it was interesting. The computer transistor switch now is only 100 to 200 nanometers wide. I mean, I was surprised how small that is. So, I mean, in development-wise, we're already making things that are only 100 to 200 nanometers big. So from a size standpoint, it doesn't seem that far off. So their description is that you're going to have this assembly of nanometer scale components either by manipulating from the outside or directed self-assembly where these pieces all find themselves and put themselves together. They make these robots that are small, and then they program them and coordinate a large number. They call them swarms, come in, and they are programmed to fix something. So this is kind of this is their depiction of what they think is going to happen. So this is a computer-generated nano-robot which is floating around in the brain. It's looking for a neuron which has been damaged. So here it is. It's finding a neuron. It's going to attach itself to this damaged neuron. You can tell by all the wilted dendrites that come out of it. This is kind of creepy right here. So it attaches itself to the neuron, and then it starts extending out its own dendrites out to connect to all the other neurons that it did connect to prior to being damaged. So the idea is that this little nanorobot takes over this role, connects these other neurons, and the pathways are now reconnected. That's what they think is going to happen in the future. So how far have we gone with this? Well, at Columbia University, they developed some DNA robots. And I want to try and explain this if I can. It's a little bit complicated, but they developed molecular robots to mark a specific cell that they wanted to find in the bloodstream. And they wanted to fluorescently tag it. So there's 5 components involved in this little robot scenario. The first 3, 1, 2, and 3, are an antibody and a double-stranded DNA. So they want to identify this cell here. It has 3 different receptors they picked. So they have an antibody for each one of these receptors. And each antibody has a different double-stranded DNA. So that's the first 3 components. So what they do is they introduce the 4th component, which is a single DNA strand, and the 5th component is a radio-labeled DNA strand. So what they start is a chain reaction. So they put this now attached. They add this, and they're color-coded for a reason because it's complementary to this strand. So what happens is this red binds here, and it comes off, and it pulls red off, leaving the blue by itself. So then the blue jumps from here to here, leaving the green. And eventually, what it comes down to is that everything starts to match up itself, and so everything jumps over one. So when the green jumps to here, after the blue jumps to here, leaves the green alone, and then finally, you have the yellow uncovered, and the yellow, which is this yellow, is fluorescently tagged as here. So now when they're all done, and this takes about 15 minutes for this to happen, this cell is now radio-labeled. And all they did was program a series of DNA tags. They're calling them nanorobots to do the work. So they found the cell they wanted, and their idea is they could put something else on here, not radio-labeled. They could put a drug or a toxin, say they wanted to kill these cells, say it was a cancer cell. They could label these DNA robots to find a specific cancer cell. And so they have to pick enough receptors so they know that they're picking the right cell and not a cell that has the same receptors that's a good cell. So they started with this, but this is really how far they are in nanorobotics. So it's a far cry from having a self-contained miniature robot go in and repair a neuron. Back in 2005, this was the cover on a Discover magazine. So they've been talking about suspended animation since then. It's defined as the slowing or stopping of life processes without termination. So breathing, heartbeat, and other involuntary functions may still occur or they may not. It's kind of it can be there or none or somewhere in between. They set the person's biological processes on hold. The exact definition is the therapeutic induction of a state of tolerance to temporary complete systemic ischemia, along with protection, preservation of the whole organism during prolonged circulatory arrest, more than an hour. And then you have to resuscitate him back to normal without brain damage. So all 3 of those have to be present. Fantasy writers have been captivated by this concept, and we see this in a lot of science fiction movies. Fictional tales allow characters to sleep through centuries and wake unaffected. Rip Van Winkle. Now, he wasn't hooked up to anything. He just slept under the tree. In reality, though, we don't appear that we are capable of altering our progression through life like this. We can't pause the activity of our cells, stop breathing for more than a few minutes without sustaining damage. Or can we? What about these cases? 35-year-old Japanese guy went up to a mountain to a party. There was drinking involved. He was found lying in an ice-cold field with no pulse, body temperature 71, wasn't breathing. He'd been missing for 24 days when they finally found him. So he was taken to the Kobe hospital. He was warmed. He woke up, had a full recovery, no signs of brain damage. 29-year-old orthopedic resident in Norway fell into an icy river while skiing, and this is a depiction of the picture of what happened. She fell through, went headfirst in. She was trapped under here with just the skis and her feet sticking out. The people who were with her could not pull her out as she was wedged in under the ice, and the ice was too thick. She was under the water for 80 minutes. Body temperature is 56 degrees, no vital signs. They took her to the hospital, resuscitated her for 9 hours. She woke up 10 days later, paralyzed from the neck down. Interestingly, she did not have a neck injury. However, she subsequently spent 2 months of rehab, recovered completely, and now she's a radiologist. So it took this event to change her mind from orthopedics to radiology. But she survived. So do these freak events provide evidence that humans do have the ability to go into suspended animation and come back? It is already possible in some human cells. The ovary. 100,000 oocytes remain alive in a state of suspended animation for years, waiting for their turn to ovulate. So some cell lines in humans already do this. Nature abounds with organisms that suspend and reversibly arrest their life processes. There's a number of names for this, which kind of leads to some of the confusion. Torpor, that is a term they actually use for astronauts. That's the term they try and use. Quiescence, hibernation, they all represent different degrees of suspended animation. So hibernation is a form of suspended animation, and so is cryonics. So there's a varied degree of being in suspended animations. When you look at the animals that are in suspended animation, they have resistance to changes in temperature, oxygen deprivation, and even physical injury. So Arctic ground squirrels go into hibernation all winter. They do not reawake, they're in hibernation. And so they did this study on hibernating and non-hibernating Arctic ground squirrels. They injected 0.5 millimeter probes into their brain and then took them out. When they looked, this is the hibernating brain and this is the non-hibernating brain. Same spot where the needle was put. There's very little, if any, damage noted on the brain section where the hibernating animal was, versus this has a big hole, and there's all sorts of lymphocytes and cells that have come in to repair the damage that was done by this 0.5 millimeter probe. So it's seemingly they're resistant to injury when they're hibernating. So if humans could be put in a similar state, the implications for medicine would be huge. Organs destined for transplant no longer would be on a time frame where we only have a few hours to find the donor. You could put the thing in suspended animation, and rather than keeping things regional because you have to go where the organ can get there in a certain amount of time, you could just put in suspended animation to get it to the person who needs it the most, no matter where they're located. Buy time in critically injured trauma patients, giving physicians time to repair injuries they have. Non-trauma complex operation, aortic arch replacement, where no blood flow would make the operation a lot easier. Slow down metabolic demand and oxygen requirements in acute MI patients. So when we look at nature, suspended animation, there's a diverse range of creatures who stop their activity in response to different stress. Seeds, I mean, you can plant seeds. If the conditions aren't good, nothing happens. A year later, conditions are good, they just come up. Artemia franciscana, the sea monkey. Everyone has sea monkeys. Those things come in a bag. That bag can be like that for 5 years. They have no food, no water, no oxygen. You dump them in the fish tank, and they come alive. So they can survive 5 years in a bag with nothing. Frogs, salamanders, and fish do this in the summer. They actually, in the heat, they actually go into a suspended animation state to avoid the heat. Of course, ground squirrels and bears are the ones that we commonly know that undergo hibernation. And this range of animation is truly halted, to just slowed metabolic activity, so it depends. They now found that hibernation-like effects can be induced in animals that don't hibernate. And that the methods that they've developed to induce this in these animals shows that this capability actually could be latent in mammals and in humans, and that it might have been there from the earliest days of microbial life on Earth when there's very little oxygen. So we may have the ability that's there, it just hasn't been used for millions of years. As we know now, humans depend on a steady stream of oxygen. Without it, ischemia and tissue death. This energy comes from ATP, adenosine triphosphate. It's formed by oxidative phosphorylation. So oxygen's used to form ATP. ATP is the gas. So when your oxygen level is low, ATP is not formed, your cells run out of gas, they can't maintain their cell potential, electrolytes leak back and forth, you have cell death. When the oxygen level drops off low, not gone, but low, cell processes continue on, and oxidative phosphorylation tries to continue, but it doesn't have enough oxygen to form ATP. So what happens is it just stops prematurely and releases, unfortunately, oxygen-free radicals, which are damaging. So this continued cellular activity at a hypoxic level leads to the formation of these oxygen-free radicals. So everything that we do in someone who's suffering, CPR, resuscitation, is all aimed at increasing oxygen flow to the cells to prevent ischemic damage. So with our cells, it seemed like strict oxygen requirements is the only possible strategy that we have. Animals in suspended animation reduce their activity and they're resistant to ischemia. So, one, can we induce the same conditions in human? And what are the mechanisms that large mammals like this use, and can we make them work in humans? So we'll take some lessons from a worm. This worm lives in the dirt, so it lives at the same oxygen level as us. Cyanorhabditis elegans, it enters a state of suspended animation at any stage of life in response to anoxia. So 0.001% or less oxygen. Our tissue really probably never drops to this level of anoxia during an insult or injury. We get to hypoxia, not anoxia. So there's enough oxygen around for oxidative phosphorylation to try and go on, but it's not enough to actually make any ATP. So this residual oxygen is left in the tissue, continues this process of free radical formation. So what they did is to mimic the human is they exposed this worm to hypoxic levels, not anoxic levels. And what they found is that the embryos don't enter suspended animation. They continue on just like humans, suffer cell death, and die. If they increase oxygen just to 0.5%, it goes normally through embryogenesis. So there's a tenfold difference between lethal and non-lethal. So it suggests that, one, ischemia can be avoided by increasing oxygen. That makes sense. But also by decreasing the oxygen. So it's difficult to keep an organ destined for transplant oxygenated for a very long period of time or get more oxygen to a trauma patient. So doing more than what we already know, we don't have technology yet to do that more. But we might be able to decrease the oxygen level. So if we can't get any more there, maybe we can cut it down to anoxic levels. And they kind of draw this curve as the lethal middle ground, is that on this side, normal oxygen level, we have normal oxygen, high viability of the animal. This side, we have very extremely low anoxic levels of oxygen, high viability animal. It's this inner period right here, between the two, where the intermediate oxygen level leads to low viability. It's that they use very little oxygen, there's very little there, and we use all sorts of oxygen, but there's there, but it's this period here, it's this middle ground, it's when we're hypoxic. So how can we reduce a cell's access to oxygen? There's two ways to do that. One, remove the oxygen from the tissue, or use oxygen mimetics. So things that look like oxygen but don't release anything. So we're going to go through. So under the oxygen from the tissues, there's two researchers we'll look at, Rita from Arizona and Safar from the Pittsburgh group. And then we're going to look at carbon monoxide and hydrogen sulfide. And remember at the beginning I showed that slide about the mistake that the student made in Germany, and they left the cells in too long and it smelled really bad. It was hydrogen sulfide. So at USIS, Peter Ree in 2000, they used Yorkshire swine, whose physiology is close to humans. They created a large intra-abdominal artery vein injury, something like you got shot or stabbed. They bleed the pig out, they collect the blood, and then they chill them down to 50. So they basically take all the blood out and put cold fluid in. The pig is dead. They unhook all the monitors. There's no vital signs. They waited 3 hours. They repaired the injury, and then they put the warm blood back in, and they had a 90% recovery. And within the realms of testing a pig, neurologically, there were no deficits. I mean, they weren't paralyzed, they walked around, they ate, that kind of stuff. So it was possible to bleed someone out, bring their temperature to 50, wait 3 hours, and bring them back. Pittsburgh, there's a guy named Safar there. I think he's dead now, but his group has been studying for 20 years on suspended animation in dogs. So in 2005, they published their data where they flushed the blood out of the bodies, replaced with cold saline with oxygen and glucose. They then had cardiac arrest as soon as they started cooling them down, and they have 14 dogs were clinically dead. After 3 hours, they then reversed the steps. They had to shock them back alive. They all survived, a small percent with neurologic damage. And so PETA got a hold of this, and they were making the zombie dogs. Well, it's interesting that Pittsburgh is the zombie capital of the world because that's where Night of the Living Dead was filmed. But Pittsburgh's not the first to create a zombie dog. And I have to say, I stumbled onto this video by accident last night. It's from 1940, this video. The Russians...
The arterial pump takes arterial blood from the reservoir to the head, while the venous pump drains off the venous blood. The artificial blood circulation ensures the metabolism necessary for the life of the head.
The isolated head lives on for hours and reacts to external stimuli. The isolated head even reacts to light and to sound.
There isn't no body there. This is an isolated head. Yeah, the drawing, they put tubes in his neck. He's just, they killed the dog, they cut his head off. They just ran these tubes in the carotid artery and jugular veins, and they're just circulating cooled blood that they have in a reservoir out here through him, and he's still alive without anything else, and this is going on. This is from 1940. So, oxygen mimetics, we're going to look at hydrogen sulfide. A guy named Roth, who works at the Fred Hutchinson Cancer Center, I think it's out in Oregon. Hydrogen sulfide is very similar to carbon monoxide. It binds to the oxygen on the hemoglobin, but since it's not oxygen, it doesn't do any good and it doesn't release anything. So they figured out from OSHA data what the lethal and toxic levels of hydrogen sulfide in mice are, and they calculated a non-lethal dose, and they put these mice in a sealed chamber, and their non-lethal dose was 80 parts per million. And they exposed them to 80 parts per million of hydrogen sulfide. What they noticed that within 5 minutes, their CO2 production dropped threefold. That is their indirect measurement of metabolic rate. They were forming less CO2, so their metabolic rate had dropped threefold in 5 minutes. Their core temperature fell. Their respiratory rate fell from 120 to 10. And over the course of several hours, their CO2 fell tenfold, and the core temperature fell to 2 degrees above the temperature, no matter what it was. So they could drop the animal's temperature to 15 degrees just by cooling the chamber, and then the animal would lower its temperature 2 degrees just above. And that's exactly what occurs in naturally hibernating animals. So in effect, hydrogen sulfide exposure converted a warm-blooded animal into a cold-blooded animal. They kept the mice like this for 6 hours, and then they revived them, and a battery of tests, which means they ate and had to go through a maze, I would think, showed no functional or behavioral ill effects. So for some reason, hydrogen sulfide seems to trigger a latent hibernation response that seems to exist in all mammals. Now, that doesn't seem like it's going to be very helpful for us to expose us to hydrogen sulfide. One, it smells bad. Two, you close the trauma patient in a chamber and expose them to hydrogen sulfide while you're bringing them to the hospital. So they've termed this, the resuscitation in humans, emergency preservation and resuscitation. So we now have another terminology. It's not suspended animation, it's not torpor, it's not quiescence. It's emergency preservation and resuscitation. When you look at 80% of trauma deaths, they occur in the early post-traumatic phase, and bleeding is the #1 cause. Often the underlying cause can be fixed, but the patient dies of shock or brain damage before you can fix it. And so the new approach is required, and they call this emergency preservation, and it's rapid total body preservation, repair of the injuries under total metabolic arrest, and then controlled resuscitation. That's EPR. Currently, hypothermia is the most effective method that we have. Now, there's a difference between induced hypothermia and hypothermia secondary to shock. When someone comes in, they're hypothermic from an injury, that's something that shows you this person has total metabolic failure and they can't maintain their own body temperature. That's different than induced hypothermia. So if someone's injured and they come in and they're cold, that's not like, hey, we're halfway there. They're already in metabolic failure and they're beyond. So induced hypothermia is different. This profound hypothermia must be induced rapidly at 2 degrees Celsius a minute, reversed at a slow rate, ½ degree a minute, optimal depth 50 degrees Fahrenheit. Safe duration in trauma is about 60 minutes. So what they found so far is there's no increase in postoperative bleeding and septic complications, at least in the animals, and that technically it's feasible to use a small battery-operated portable equipment. And the military is looking at this as they're trying to figure out how to use this technology in the field. So this thing has been developed. This is a little pump. All you need is 2 catheters. Red's artery, blue's vein. You put this pump on. So you're supposed to circulate this down the patient out in the field while you're bringing them in. So the military is very interested in this technology. What they found is, and when you induce hypothermia, not only does your metabolic rate drop, other subcellular and cellular mechanisms begin. One they found is that there's a significant reduction in lactic acidosis, so that no longer are we having anaerobic metabolism. We're having no metabolism, so no lactic acid is being formed. The other thing they found is that anti-apoptotic cell death genes, which they didn't even know existed, actually are expressed. And they protect the hypothermic patient from cell death. And so that's another reason they think that some of this stuff is actually in our genetics, that we have the technology, we have this in us. It just hasn't been used for millions of years. So overall, you have an upregulation of pro-survival genes and pathways and a downregulation of your metabolism. So this trial was developed and it started this year in the United States, the Emergency Preservation and Resuscitation for Cardiac Arrest and Trauma, the EPAR-CAT trial. The primary endpoint is survival to hospital discharge without major disability, and they're going to look at the Glasgow Outcome Scale. They're also going to look at what's the feasibility of inducing this and achieving goal brain temperature, survival at 28 days, neurologic outcome at 6 months, and is there a multiple organ system dysfunction when you do this. Inclusion criteria for this trial: penetrating trauma with clinical suspicion of exsanguinating hemorrhage. They have to have at least one sign of life at the scene. That could be either a pulse, respiratory efforts, spontaneous movements, or reactive pupils. A loss of pulse less than 5 minutes prior to ED or arrival in the ED, or an ED thoracotomy performed without immediate return of a palpable pulse in the carotid arteries after clamping the descending aorta. Exclusions: no signs of life for more than 5 minutes, obvious non-survivable injuries, so we cannot really bring people back who are dead, suggestion of traumatic brain injury such as cranial distortion or facial distortion, asystole. If they have, external assessment shows that they have a significant amount of blunt trauma involving multiple regions, pregnancy. Prisoners, I really thought, well, why prisoners? I mean, why not? But prisoners are excluded. 4 locations in the United States involved in this trial: University of Pennsylvania, Arizona, Oregon Health and Science University, and the University of Maryland. So what they do is you come in and you just died. They open your chest, they clamp the aorta, and they put a catheter in the aorta. They perfuse the heart and brain first because they're the most sensitive to hypoxia. ice-cold saline to cool it down. They then remove the clamp and then perfuse the rest of the body. It takes about 15 minutes for the patient's temperature to get to 50. At this point, they've been exsanguinated, they've been cooled, there's no brain activity, there's no respirations, there's very low metabolic activity at all. They remove all the monitors. So they unhook you, no blood pressure, no pulse, no nothing. When you look at normal body temps, can sustain itself for about 2 minutes. At low temps, the glycolysis rates are so low, cells can survive for hours. So now they get about 2 hours to fix what's wrong. So now with no monitors hooked up, no bleeding, nothing's pouring out, they can just open you up, fix what's wrong. They then resuscitate and rewarm you with full cardiopulmonary bypass. They're going to test this on 10 people total at the 4 centers, not 10 each center. And then they're going to compare the outcome with 10 others who came in the same way but did not have this treatment because the team wasn't available. Then they're going to look at their results, refine the technique, and they're going to continue to do it by tens until there's enough results to analyze the data. The FDA considered this exempt from informed consent. So no one has to give their consent for this because they're dead when they come in. So their take on this was that there's no other alternative other than death. So there's no consent required because there's no other treatment alternative. They're just dead. They did place ads in the newspapers with an online opt-out, so you could sign in online and say, I don't want this. But to date, no one has signed on, so either they didn't see it, or no one wants the opt-out of it, or they didn't think they were going to be the victim of a crime where they were going to get shot or stabbed and they'd have to worry about this. So there's many examples of suspended animation in the animal world. We may have the latent ability to enter suspended animation. It appears that mammals can tolerate anoxia with return to normal. So we've seen it in pigs, we've seen it in other mammals. Exposure to hydrogen sulfide, hypothermia, we can go and come back with apparent return to normal. This trial hopes to answer if it's technically feasible to induce suspended animation in an unsalvageable trauma patient population, repair their injuries, and then return them to normothermia without brain injury. And that's what I got. So it's a long, circuitous route to get to that trial. But I thought in order to understand why they're going to try and bring dead people back, you have to understand where we are in suspended animation in the first place. So it's never been tried in human successfully, but we'll see. Well, no, I wanted to show you well, yeah, but see, that dog was now going to look like it was going that zombie dog. All right. Well, we saw the zombie dogs from Pittsburgh. You know, not all those dogs that they froze and brought back to life, they had some neurologic damage. So it wasn't the headless dog that I showed you from Russia. It was the Pittsburgh dogs where not all the dogs came back to normal after they were cooled down and brought back to life. And so, you know, that's exactly kind of what the Lazarus Effect movie is that these dogs are dead and they're trying to give them this Lazarus solution and then shock them back. And they're not quite normal. No. But the movie's not about dogs. The Lazarus Effect is not about the dogs. A human gets involved in there. All right. If there's no questions, thanks for coming.